The World Health Organization estimates 3.8 million premature deaths are caused each year by indoor air pollution. And with October being National Indoor Air Quality Month paired with COVID-19 concerns, indoor air quality is a critical issue generating global attention. Joining us now is Dr. Taz Bhatia, who's teaming with Ambius to discuss new virus killer technology and also promote indoor air safety. Good morning, doctor.
Good morning.
Great to have you joining us. Let's talk about this, the indoor air quality. Why is it so important?
Well, I think, coming off the heels of the pandemic, we've seen firsthand that aerosolized pathogens can spread really quickly. Viral particles can make us sick really fast, and we've got to find ways of sort of controlling it and staying ahead of the game. We also know from the Environmental Protection Agency that we're spending 90% of our time indoors, and we're kind of worried about it. Ambius did a study that showed that 69% of us are worried about spaces and our exposure to things like viruses, bacteria, chemicals, allergens, even our risk for asthma. So we need solutions, and we need solutions that work to keep us all healthy for the long term.
Well, what are some of the ways that people can start improving the air in their home or workplace? I know at my house we bought a couple air purifiers to try and help clear out some of the air.
Definitely, and this is why I'm excited to partner with Ambius. Ambius was already in the indoor air quality space. They were using things like green walls and hygiene techniques, scenting, all to improve indoor air quality. But their latest product is the Ambius virus killer, and that actually has patented technology that takes dirty, toxic, and sick air, and it filters it, it neutralizes it, it decontaminates it, moves it away from our breathing zones, and then pushes it back out into the environment so that we have a cleaner air product. And the entire process has been shown to remove about 99.99% of viral particles from our environment. So it is something that allows us to have peace of mind and sort of take control of this issue.
Right, and we are all more aware about the air we're breathing in, as you mentioned at the start of the segment. Talk about the health impacts and just how dangerous it can be when we're breathing in bad air, whether it be inside or outside.
Definitely. Well, when it comes to indoor air, what we've seen, and we've seen this in research pre-pandemic, we've seen it in the exam rooms, we know that poor indoor air quality is linked to more respiratory issues, more congestion, more issues with focus and concentrations, and even, more issues with mental health. So we know we need to change it, and when we clean the air up, we find that people actually have more productivity, more energy, they feel happier, more balance. So there are a lot of benefits to cleaning up our indoor air, and we're getting exposed to it from so many different places. So we want solutions that are easy to work and actually are really effective as well.
Oh, I hear that. Can you give us any examples of some of the indoor air pollutants that are actually dangerous that we're not thinking about and how they spread? Because it's not like we can necessarily see them.
You can't see them, and that's probably what's the most frustrating, right? Like a lot of times we talk about toxins and you can read it on a label or you can, buy a certain type of food. But when it comes to indoor air, most of those are spread by a concept called off-gassing, where they're just kind of emitted off the surfaces of things like your kitchen stove, paint, flooring, furniture, your household cleaning supplies. And what we're breathing in are something called volatile organic compounds, or VOCs. And we know there's the science there to show that it has an impact for sure on our health. In addition to that, you have dust and particulate matter, mold spores, and so much more. All of those factors together determine what your indoor air quality is going to look like. And so it does have, health consequences. So we need to make sure we have a way to stay ahead of it rather than being behind it.
Dr. Bhatia, can you talk a little bit more about this new technology, this virus killer, how that's different from some of the indoor safety air solutions?
Definitely. So I love the virus killer for a couple of reasons. First of all, the technology there is a 3-layer filtration system. So it's got 3 layers of sort of filtering these particulates and all this stuff through. And then there's a UVC reactor attached to it as well. So that's why they're able to get to that 99.99% removal of viral particles. So that's the technology part of it. The other part is the convenience part. I mean, there are little personal ones that are easy to carry. I literally carried one into here today to use. And then there are larger ones for larger spaces as well. So there's the convenience piece, and then there's definitely the innovative and effective technological piece.
And doctor, how soon can someone who's using one of these devices, this new technology, how soon would they see a difference or notice a difference?
I would say, from my experience, I would say that they will notice something within a week or so. Because once you start cleaning up that air, you literally feel better. It may not be like something drastically changes in a week, but you definitely feel better.
All right, great information. Very interesting and good to know. Thanks, Dr. Bhatia. And for more information, you can visit ambius.com/viruskillertv.